Hello, welcome back. The topic today is hydrocele and hernia. What are the differences? So, hydrocele is nothing but fluid collection in and around the testis. Hernia is a abnormal abdomen organs protrusion through the anterabdominal wall into the scrotum. So, we all know because of the previous videos. So, hydrocele is nothing but some fluid collection. Normally, our testis in a male is placed outside. It's within the abdomen near the kidney, and as we grow inside the abdomen, it descends down, and just before the birth, it comes out of the abdomen wall into the scrotum. Why? Because the outside temperature is lesser by 1 degree, so the testis is little cooler. So the production of sperms are very effective. So that is the reason why the testis is outside. And for the same reason, we have a covering. We have a covering which secretes some fluid to keep the testis cool. So when this covering secretes fluid and it's not absorbed properly, the production of fluid is more, causing swelling in and around the testis. That's called hydrocele. So how to diagnose? Generally, this can happen for any age. Generally, even it can happen even the childbirth. That's called congenital hydrocele, or it can happen in the adulthood also. Most of the time, these patients will give a history of some injury or infection. Usually, there will be a mild injury like while cycling, or maybe some sports activity they will say, or some they are an infection. So whenever there are hydrocele, usually we also rule out elephantiasis, filarial disease. So this is one part. The second part about the hernia, again, it can happen as a congenital one, but mostly it happens in the adult and old age time. The reasons are all heavy work, or maybe strenuous work, weightlifting, all the other causes. Okay, how to diagnose this? Mostly, even the patients can diagnose it, but the doctors, by examination and some history, they can diagnose it. And usually, there are two tests they will rely on. One is a transillumination test. Suppose you have a swelling in the testis and it's uniform, like so the tense bag of fluid. The usually hydrocele looks like a tense uniform. It looks uniform and in a tense bag of fluid. And if you put a torch light through one end, you can see the other end, the light. That's called transillumination test. That will be positive. But in a hernia, the swelling usually is irregular. The shape will be not uniform. And if you do a transillumination test, the light cannot travel from one end to the other end because of the intestine. So that the transillumination test will be negative. The second one the doctors rely on is get above the swelling. So in the hydrocele, you can get above the swelling. You can pinch, fingers. But in a hernia, because the intestine is there, you cannot get above the swelling. So because the intestine is in between. So this is how they differentiate. And if needed, they will do ultrasound or even CT scan to confirm these things. And treatment wise, for hydrocelectomy, where they remove the secreting surface and make it exterior, so the fluid absorption is there and disappears. In hernia, we have to do the surgery, because hernia, usually hydrocele presents as a, usually hydrocele will not give you any pain or even complication. Mostly there is no pain and no complication, only a cosmetic thing, like there is a swelling, and if it's bigger and they may feel some heaviness. Most of the time they avoid, it's very difficult for them to tuck in the shirt, or even in a public swimming pool they'll avoid. These kind of the reason why we do this surgery. There is no pain and slow growing. But hernia, the cosmetic or the these are very important, but very importantly, it can go for complications like abdomen pain. It can give you obstruction, even incarceration. All these can happen. So surgery is a must for the hernia. Whatever the age, surgery is a must for the inguinal hernia. But hydrocele, if it's very small and it's not disturbing, maybe you can leave it just like that. But if it becomes bigger and becomes infected, of course we need to do the surgery. So hydrocele and hernia happens mostly. Hydrocele is purely for the male, and hernia can happen for both male and female. But these are all just in and around the testis and in the groin area. So people get confused. Most of the time, they say hydrocele as a hernia, hernia as a hydrocele, but both are, you don't have to worry about the serious, about the disease. It's all easily curable. Thank you.